Yes po, Doc. Good morning.
Okay. Yes, sige, sige. Okay, so before we start, may I hear a short recap of what we discussed last meeting. So I believe we are in the discussions or further discussions in the part of sinus, okay, sinuses, the nasal cavity part, and the other portion of the conductive system. So please, sino may gustong mag-volunteer? Okay, so may I hear from Miss Paladan? Miss Erica, are you here?
Yes po, Doc. Good morning po.
Just give me a short recap of what we discussed last meeting so that I can start on or I can continue. Okay, kasi alam ko hindi natin natapos last time.
Last time, Doc, yung topic po natin is yung type of yung rhinitis according to exudate po. Like, yung first po is we have serous exudate, and yung type of reaction niya po is serous reaction by reactive submucosal gland po. And yung implication niya po is mild irritation po. And next po is we have yung fibrinous po, which is yung type of reaction niya po is fibrinogen leakage from nasal blood vessels, and yung implications niya naman po is severe injury to mucosa. And yung iba po is granulomatous po yung exudates niya, and yung type of reaction niya po is accumulation of macrophages, lymphocytes, plasma cells, and connective tissue po. Tapos yung implication po is yung chronic inflammation, pathogens, resistance to phagocytosis po. And na-tackle din po natin yung example of purulent rhinitis po, which is yung stangles po. Cause po siya ng Streptococcus equi. And yung example of my mucopurulent rhinitis in dog naman po is yung Corpus mucopurulent discharge from nostril po, which is viral infection can predispose to dog to secondary bacterial rhinitis po. And yung most common po na organism dito is yung Bordetella bronchiseptica po. Tapos yung Streptococcus is Staphylococcus. Yan po, Doc.
Okay, thank you, Ms. Paladan. What about those rhinitis that cause diseases, or those rhinitis caused by pathogens in cats and pig? Who would like to add, Ms. Paladan? Thank you, Ms. Erica. Who would like to add more of what Ms. Paladan mentioned? Diba, I believe we have discussed a short view, no? Yeah, short view of the cats and pigs. Tama ba? Okay, may I hear from Mr. Villarreal. Jack, okay, Villarreal. Okay, so Jack, nandiyan ka?
Yes po, Doc.
Okay, sige. You just continue or add what Miss Paladan just mentioned. Jack?
Doc, ano po ulit yung question?
Sabi ko, dagdagan mo yung sinabi ni Miss Paladan because I know we did not just stop on that area. Ano pa? Aside from nung sinabi ni Miss Paladan. So I think, may I hear other from Miss Besmano? Can you add what Miss Paladan recapped from our last discussion? Janine, nandiyan ka?
Yes po, Doc.
Okay, go Miss Janine. Dagdagan mo yung sinabi niya. Actually, I've mentioned about this kung nakinig kayo. Nakakasabi ko lang kanina. I just want to know if you still remember. So, Miss Paladan
Doc,
ended
sorry
on
po,
the
hindi ko
descriptions
masyadong
of...
maalala.
Hindi kayo nagbabasa notes. Okay, may I hear from... Okay, Miss Cruz. Nicole, go on.
Doc, yung sa dalawang hindi po na-discuss ni Paladan po is yung sa sakat saka sa pig, which is dun sakat po yung rhinitis saka conjunctivitis, which is pag viral po yung nagkokos po dun is yung feline calcinovirus tapos yung feline infectious rhinotracheitis. Then kapag chlamydial naman po is yung chlamydophila ano na yun? Sitasi. Tapos yung sa bacterial naman sitasi. Tapos yung sa bacterial naman po is yung Bordetella bronchoseptica, Escherichia coli, Streptococcus, then Staphylococcus po. Then kapag mycotic naman po is yung Cryptococcus neoformans po, Doc. Then pag sa ano naman po sa pig naman po is yung pinaka-common naman po is yung atrophic rhinitis wherein po yung ano po there is an atrophy sa nasal turbinates po ng mga pig, which is anong tawag doon? Kapag bacteria po yung pinaka nagko-cause po doon is yung Pasteurella multocida, Pasteurella multocida D. Tapos yung
Type
saka
A and D and...
type A and D. Tapos yung Bordetella bronchoseptica din po, Doc. And then pwede din po yung Mycoplasma species po, Doc. Pag ano naman po kapag
secondary.
nutritional naman po, Doc, is vitamin D, calcium, tapos phosphorus po, Doc. Yun po yung naalala ko po, Doc.
Okay, wala na. Hanggang doon na lang. What about the sequel? So, the sequel of rhinitis and sinusitis. So, do you still remember on the retropharyngeal lymphadenitis? What else? Yung sequel otitis. What else? Di ba may sequel tayong ganun? Okay. Please do remember that. So, why I am mentioning those, no? That's for you to remember. Ito yun, sinasabi ko sa sequel to rhinitis. So, don't forget this one. The picture here is a half section or hemisection of a horse skull, okay, showing you the possible complications or sequel of rhinitis once this condition is not controlled. Okay, so we have the sinusitis at the same time meningitis, wherein there are some connections that could that these possible microorganisms can go through these particular areas. So meningitis encephalitis, you have also the guttural pouch mycosis. So these guttural pouch mycosis, empyema. So this guttural pouch empyema is very distinct in horses because they have this guttural pouch. Ayan, through the eustachian tube connections. And the last one is yung sasabi ko sa inyo, retropharyngeal lymph nodes to cause lymphadenitis. Okay, so don't forget this sequence kasi this is very important in terms of assessment, okay, in the assessing of the health, okay, of the nasal cavity. Okay, now we continue discussion. So I have mentioned this one because of the empyema, the accumulation. Oh, by the way, thank you, Miss Nicole, Miss Paladan, for those recap. So I hope you will now remember those important points, okay, during our discussion last meeting. And now for the continuation, so ito yung sinasabi ko, no, for the presence of connection. So we have mga maliliit na butas or mga sinuses in which these are the possible means where the microorganism from one part of the nasal cavity could go through to this one, especially if complications are there and the continuous or sustained infections is there. Okay. So another one, the improper husbandry practices, particularly in cattle, yung sa dehorning natin, can predispose to sinusitis, which, okay, later, pwedeng mag-cause yan ng infection or worse if there are depositions of meiosis. Okay, meiosis fly eggs. Yan. Which can cause meiosis. Ayan. So posible yan. Kasi it will produce some openings. Okay, dito sa may horn part. Pag nag-dehorn sila. Okay, so yun yung mga possible means of entry or of pathogens. Okay, dun sa mga part ng nasal cavity. Okay, as for now, for the guttural pouch. So guttural pouch are ventral dilations of the auditory tubes in horses. So this auditory tube is the eustachian tubes. Ayan. This communicates the middle ear. That's why kapag affected yung part ng dito, no, sa may neck part, no, and then bakit pwedeng go through okay yung infections pag may problem sa eustachian tubes kasi meron silang konting connection, so may opening, so that's why otitis can be one possible sequel, okay, if there is a problem part of the eustachian tube. Now the function of the guttural pouch is uncertain but believes to help in cooling down blood going to the brain. So it's quite very important, no, knowing that horses are very active animals, and as same with its action, no, so talagang they are runners, no, so they tend to have high metabolic activity and tend to expect yung blood, it's quite hot, so sa thermoregulations yan, so ito pa itong pangtulong, okay, for the thermoregulations. Okay, so the possible infections or the possible conditions may involve too is empyema or succumb to empyema, mucocele. Okay, yung mucocele is collections. Okay, there's excessive collections of mucose productions yun or produce. Tympani because the eardrum or the ear part, the middle ear can be affected as otitis part. Okay, tympani, mycosis. Mycosis is a systemic conditions caused by fungal infections and hemorrhage. So hemorrhage could be, let's say, direct or indirect. Okay, it could be a primarily traumatic injury or just a secondary injury from the accumulations of pus, okay, doon sa area or abscesses, with abscesses on that area, and then if that pus, okay, parang irritate yung blood vessel natin, that could tend to parang open, okay, a certain yung inflammatory conditions, okay, yung certain area tas ma-diminish or anong tawag, ma-erode. Ayan. So it could cause hemorrhage, especially if blood vessels are involved. Okay, so these are the common conditions that the guttural pouch may be observed. Okay, so this is a picture of the guttural pouch. Okay, so ito yung opening, pinapakita lang siya. Okay, so this mucus, okay, yung mucus produced in the guttural pouch remit into the pharynx. So that is how it is normally regulated where it is swallowed. So flow obstructions, so yung obstructions or anything that hinder, okay, the normal flow may cause accumulations of excessive mucose, and that is called the mucocele. Okay, so mucocele. So I mentioned about this one, the guttural pouch mucocele. So aside from that, some alterations in the upper respiratory tract, okay, especially in its defense mechanisms, could result to secondary bacterial or fungal infections. So these infections I've mentioned about the mycosis, and possibly pag bacteria naman, accumulations abscesses on this cavity, no, that is empyema. Okay, so other abnormalities because of the connections, as I mentioned, no, that is tympani. Ayan, so externally, ganito yung manifestation. So you will notice here a enlarged portion of the face, okay, on the parang most proximal, okay, area dun sa my face, just below on the posterior portion of the jaw. Ayan, so below the ear. So this is where the eustachian or the guttural pouch, okay, is located. So you will notice here a mass, could either be bilateral or unilateral. Ayan. So dito, there is a swelling and distensions aside from that on the parotid. Okay. So some discharges are seen also in the nostrils. So what could be the possible differential diagnosis? So since may pus or meron tayong mga discharges nito, mucopurulent, so you think of upper respiratory system disease in horses affecting this part. So I've mentioned about mga streptococcus, okay, what else? Mycosis, yan. So it could be a mixed infection. So aside from that, some mentioned mga viral infections no as initiator, meron din yan. But definitely more on the progressive lesions and productions of yan rich exudates is caused by secondary infections. So as I've told you dun sa strangles natin, pyogenic bacteria yung nagpo-produce ng pus here. Yan, so this is how it manifested. So the clinical signs shows intermittent nasal discharge, could be unilateral or bilateral. There is the enlargement or lymphadenitis, particularly of the retropharyngeal lymph nodes. And in severe cases, this will produce the empyema, okay, of the guttural pouch that can interfere on the swallowing. Why? Kasi may pressure lumalaki. So magkatabi lang yan. So in health or let's say in normal conditions, so maganda yung positioning. But because there is a swelling of the parotid area, okay, on the guttural pouch area, so tendency is the part of the esophagus can be affected. Okay, so this actually one of the sequel. Okay, ito yung mga pwedeng mangyari. Okay, if this condition is not treated well. So this is another picture of the guttural pouch showing you the organized pus. Okay, yung mga hardened pus dito sa may guttural pouch. So ito yung opening ng guttural pouch. Okay, so there's a purulent exudates in the right guttural. Bacteriologic examinations required to identify, since ito ay nasa horse, okay, yung agent. And definitely, the most common agent isolated from this one is Streptococcus equi. And through endoscopy, there's also use, this is also important to parang affirm, okay, if the animal, ayan, has a guttural pouch empyema. Okay, so another picture of infection, okay, caused by mga fibrinonecrotic exudates that could be due to what? Systemic mycosis or systemic fungal infections. Now, always remember, I don't know if you still remember, no, but I hope you remember the descriptions of mycotic infections. So always, diba, in your bacteriology, you mentioned about plaques, mga plaques or masses, no, parang elevated plaques, hardened plaques in the affected tissue, no. So this is how it looks like sa mga mycotic infection. Okay, so that plaque is fibrinonecrotic exudate. So depending how virulent or how pathogenic, okay, yung fungal or fungi. Okay, so note for the descriptions. So round multifocal raised plaques of fibrinonecrotic exudate. So this is one. So if you see this kind, no, sa pathology natin, sa general pathology, this fibrinonecrotic exudates. So necrotizing na kasi meron tayong parang calcification yung itsura niya. Okay, so hardened. Okay, it's multifocal because the distributions of the lesion is on the varus surface. Okay, varus surface of the guttural pouch. Now, the histological picture of mycotic infection, especially of the affected tissue, no, by fungi or fungus. So napakaganda. You can see here a hyphae. Okay, ito yung mga hyphae niya. Ito yung parang branches. Okay, in mycotic plaque, isa lang yan. Okay, it's more picture of one. Okay, so you can see this picture. Okay, you can see these distributions of the hyphae. Ayan. So for the possible consequences of the guttural pouch mycosis, so you can expect some hemorrhage. Okay, ayan. So because of that, clear distributions of the arteries. Okay, dito sa area na yan. So think of swelling at this part with abscess, so that can regress. Okay, so pwede niyang tunawin because of the enzymes, no, yung integrity of the blood vessels. So that can expected to lead or result into hemorrhage. Ayan. So guttural pouch are immediately adjacent to these carotid arteries. And then some cranial nerves also can parang pass through here. So all of those important structures no kapag affected, may maapektuhan as a whole, okay, dun sa animal. So erosions of the carotid artery is important as a sequel to mycotic infections of the guttural pouch. So this manifested by epistaxis and it might cause death. Okay, it's more fatal. Okay, medyo bloody. Okay, so another thrombosis of a carotid artery could lead to thromboembolisms gundun sa brain, especially if this will become yun yung parang nasa chronic or sub chronic stage. Ayan, so that's the organized clot. Okay, so that could lead, this will be a secondary effect nito, ataxia and blindness. So depending uh, uh, on the extent, okay, of the thromboemboli lodgement, okay, in the brain. Okay, so the injury to cranial nerves is another sequel. So I hope you still remember those different cranial nerves. And in this portion, ano mga cranial nerves na dumadaan dito? Is it facial? Yeah, so there are a lot of cranial nerves that could pass through here that will affect, okay, the animal's activity. So depending on what particular cranial nerves is affected here. Okay, so rhinitis sinusitis, just to give you an idea again. So this is the picture of the rhinitis causing rhinitis causing organisms in dog. Ayan, so it's mucopurulent. Okay, so this is more of unilateral. Ayan, but it could be also possible to become bilateral. So ito yon. And then pinano nila, this is how they do the laboratory activity just to support, okay, the tentative diagnosis or tentative parang infections, okay, that can be associated to this clinical signs. So they do bacteria culture, they do virology just to see whether other microorganisms are involved, okay, in the manifestations of the lesion. So another is the biopsy. So the biopsy also help, okay, to integrate other differential diagnosis or at the same time delineate some of the non-inflammatory, okay, and some inflammatory cause of these manifestations. So other than that, these are all applicable, okay, to test the manifestations or of diseases, okay, in the nasal cavity. Yeah. So I think you hear biopsy, especially if we want to check whether the animal is harboring or let's say experiencing some tumorous condition. Okay, so the biopsy will tell you. Okay. Okay, so ayan, so medyo namagit ko na ng konti. So for the nasal tumors naman, so epidemiology or the distributions of nasal tumors in the affected domestic animals. So the overall incidence is low. Okay, however, this is most commonly seen in dogs and cats, which to lesser extent horses. And then the concept that long-nosed breeds are most frequently affected has been recently challenged. Ibig sabihin that short, yung mga kahit na maliit, okay? So, hindi masyadong maluwang, hindi masyadong long, okay? Yung kanilang nasal bone, okay, yung mga long nose at saka short nose na breeds, no, they can still be affected by tumors. Kasi depende kung anong tumor yun. Okay, so always remember that the nasal cavity is lined by mga epithelium, and this epithelium can be and blood vessels can be subjected to tumorous infection. Okay, so another picture here, some tumorous which is associated with pathogens is the retrovirus, okay, causing carcinoma in ruminants. So pathology, 80% of the tumors are malignant and could arise from, I mentioned about epithelial mesenchymal cells. Ayan. Some can be benign. Ayan. However, benign tumors are more rare. Okay, carcinomas are more common. And carcinoma, it is a malignant tumor. Okay, so clinically, the severe case in tumors may result to craniofacial deformation. So depending on where that particular tumor is located or developed. So pwede, kasi yung pressure na yan, especially pag bata pa siya, no? Then yung area na yan, pwedeng ma-deviate. Okay, dun sa area kung nasa affected siya. Okay, so what else? that craniofacial deformations can also lead to some extent exophthalmia because of the pressure. So pwedeng kung dito sa malapit sa upper sinuses, no, pwedeng i-push out yung mata, okay, yung eyeball. So other than that, metastasis. So metastasis is one-way process of how the tumor, okay, mga tumor cells go through or distributed in the other parts of the body. Okay, so pwede rin yan. And it can also be, ayan, yung kanyang metastatic activity can invade, okay, other structures like the brain and damages nerves. Okay, so yan yung mga common. Okay, so this is just a picture of a canine nasal carcinoma showing you, yan, so may deviated portion of the concha, okay, dun sa may turbinates area. So you will notice here the tumoral mass. So there's a necrotizing and organized, okay, features of this portion of the nasal cavity. So the most common carcinoma in dogs, ayan, is fibrosarcoma, osteosarcoma, or chondrosarcoma. So fibro, so ibig sabihin yung fibrous connective tissue that is present on this part, okay, become organized and neoplastic. So same osteosarcoma on the bone, okay, so mga bone cells natin that could altered or neoplastic, and chondrosarcoma for the cartilage. So those are possible, okay, means of nasal carcinoma. So other than that, so we have the epithelial tumors like carcinoma, adenocarcinoma, and some undifferentiated carcinoma. So biopsies and cytological examinations are very much needed to identify the type of carcinoma. Okay. So for feline, so we have here enlargement also on the part of the parotid area, okay, on the upper neck. Ayan. Affecting also on the just behind or below the ear. Ayan. So there's a swelling on the facial bone. And then upon examinations, they saw it that the animal's losing teeth. So cytologically, the nasal lavage fluid is being utilized to test, okay, if there's a possible entity of carcinoma or neoplastic cells. Ayan. So nakita nila that this is carcinoma. So if this happened to feline, so this might cause poor prognosis, okay? And they do the what we call euthanize activity for this reason. Okay, so ito yung nangyari. So at necropsy, you will see here, napakagandang orientation. Napakaganda talaga eh. Okay, the polymorphism of the affected cells. Ayan, so you will notice here some of the different or may mga malalaking nucleus. Ayan, tapos organized connective tissue. Ayan, may mga divisions very active. Ayan, so dito, eosinophilic cytoplasms. Okay, this some of the eosinophils, ayun, yung mga eosinophils na yan, yung mga pinkish na yan, have large nuclei containing prominent nucleoli. So, nakikita nyo yung yan. Ito kasi hindi masyado makita, maliit. Okay, so yan, yung may organizations na yan. Some are fibrous connective tissue. Okay, so this is the feline nasal carcinoma. So this is another carcinoma affecting equine. So the most common carcinoma is your tumor is your fibrosarcoma. So occupying, okay, a large portion of the nasal cavity. So if this happen now, it could produce pressure and pressing on the septum sa gitna. So ito yung may konting deviation sa mangyayari. Okay? So for the sequels, so it could metastasize up to the brain, which can damage the brain cells or portion of the brain and nerves. Yan, pwede rin. So this portion and the cribriform plate by eroding. So what will be the possible affected activity of the body at the cribriform if the cribriform plate is affected? Okay, so yan yung mga assessment. Okay, so in tomography, so this area, so merong nag-lodge dito, thromboemboli, okay, dun sa area na to. Okay, so yan yung mga assessment, okay, to see the changes, okay, in the behavior of the animal if they are affected with this kind of tumor. So aside from that, we have also the enzootic ethmoidal tumor. So the ethmoid part is affected. Okay, the ethmoid is the common composition. Okay, endemic nasal carcinoma, endemic ethmoidal tumor, which is a retroviral-induced neoplasia in sheep, goats, and cattle, or in ruminants. Ayan. So clinical signs are non-specific, but it could cause hemorrhage. Ayan. So sa ethmoid part kasi it's very vascular. Okay, area na yan. So this tumor can also be infected with mucopurulent nasal discharge. Ayan. Okay, so I've mentioned about the clinical diagnosis. So the most common clinical signs that you can suspect if the animal is suffering from tumorous growth, okay, dito sa may nasal cavity, persistent nasal discharge, epistaxis, airflow obstructions, facial deformity, and exophthalmia are two of the important characteristic that could differentiate it from the other differential diagnosis. And if there are metastasis, okay, neurological signs can also be seen. So clinical diagnosis, biopsy, and CT or MRI, pinakita natin kanina, and rhinoscopy for the nasal cavity assessment. Okay, so the biopsy will clear between the conditions non-inflammatory and inflammatory. So that non-inflammatory is more of the neoplastic condition. Okay. Next is laryngitis. So laryngitis particularly seen, okay, in actually in domestic animals, but sometimes this laryngitis can be a sequel, okay, of an underlying disease. So in other instances naman, so pag nagkaroon ng lodgement, and because of sa mga bolus, or kapag may entity, or always remember that the nasal mucosa, the oral mucosa, yan, ay may mga microflora yan. Okay, so the larynx, okay, at the same time, yung opening, okay, sa mga mucous membranes natin sa nasal cavity ay may mga microflora. Okay, so the tendency is there will be or there is a possibility of invasion, okay, ng mga bacteria. Some of these are Fusobacterium necrophorum, which causes this necrotic laryngitis as part of the calf diphtheria. The calf diphtheria is a condition in calf. Yan, sometimes may variations dun sa mortality, however, pwede rin naman siyang matreat. Pero in acute form, no, pwede siyang mamatay. Ayan, so the fibronecrotic diphtheritic exudates, okay, in the larynx, ayan to, which is secondary infections of the Fusobacterium. So sometimes, if this is being compromised, okay, by the infectious bovine rhinotracheitis and other like trauma, okay, pang mga obstructions. Kasi this IBR trauma could be the initiating etiologies or initiating factors, okay, for the invasions of a secondary bacterial infections. So ulitin ko, the consistency or the descriptions of the exudates or lesion is fibrinonecrotic diphtheritic, okay, lesion, okay, from a necrotic laryngitis. So the pieces of the exudates can be aspirated, ayan, and can go through the lung or go through below or dun sa lower respiratory system. And if that happen, yan, so dun sa part ng bifurcation, okay, before it will go through the lung tissue, ayan, pwedeng mag-cause siya ng bronchopneumonia. So, affecting the bronchial airways and a portion surrounding, okay, surrounding yung bronchial airway, okay, the tissues on the lung. So, that is bronchopneumonia. So, a portion of the bronchial airway plus a lung tissue. Okay, so that's the bronchopneumonia. So in pigs, the lesion associated to secondary infections is restricted, okay, to the oral mucosa. That's why I mentioned about the nasal mucosa and the oral mucosa. Okay, kasi meron niyang mga microflora, no, and one is the fuso. But definitely fuso can also be acquired dun sa environment. Ayan. So the cause, okay, So the conditions that can be produced or developed is oral necrobacillosis in pig. Okay, so yun, mag-erode yan yung sa bunganga niya, tapos maapektuhan hanggang dito sa may part ng larynx and portion of the pharynx, yan, hanggang doon. Pwede siyang mag-extend, okay, mag-progress. Next part of the conductive system is trachea. So, in your anatomy, there are parang different characteristics of trachea, especially on the rings and the completeness or incompleteness of the ring. Okay, but definitely the compositions of the lining, the same lang yan. Okay, they have the same. So the exposure to different foreign factors, or let's say other pathogens or mga pathogenic organisms, etc., or the likes, no, could affect this structure. Now, let's see here, we have the viral tracheitis. Now, viral tracheitis, if you still remember how viral infections manifest. So always, it started on an hyperemic status. So usually yan, pag mga viral infections yan, mag-start sa mild or are hyperemic. And if this become progressive, no, so depending na kung may mga other secondary, okay, invaders, this will change. Asan from naging hyperemic, okay, pwede rin siyang maging hemorrhagic, okay, depending also on the pathogenicity and virulence of the virus and how the animal respond, okay, to the viral infection. So sa viral tracheitis, ayan, injury, inflammation, repair for trachea and bronchoidentical. So we mentioned about this one during our yung repair, regeneration repair, pagdating sa normal aspect of physiology. Okay, histology and physiology. Okay, regenerations and repair. Dun sa first module natin. So it has the same. Okay, so pure viral tracheitis, CNAT necropsy are not fatal unless complicated. So I mentioned about the secondary bacterial infections. So this is a viral tracheitis. And some examples where you can see hyperemic trachea, no, yung mga viral infectious diseases affecting sa fowl. Okay, especially yung mga target nila is a nasal cavity pag may mga mucosal or sinusitis ng ganyan or rhinitis na yan. And then meron kang there will be some pneumonia, no? So particularly on the development of that disease, it might result to viral tracheitis. Sa fowl naman, if you are familiar with infectious laryngotracheitis, ayan, ICH also in canine, yan. So titignan nyo, so those area can manifest this kind of lesion. Okay, so viral bacterial tracheitis, ito na. So depending on the invasion of secondary bacterial infections. So the consistency or descriptions of the lesion here in the viral plus bacterial tracheitis or bacterial microorganism. So there is an accumulation of fibrino-necrotic exudates in the trachea. Excuse me. So the trachea or the tracheitis or inflammatory conditions is in combinations with rhinotracheitis, o nasabi ko na, laryngotracheitis, tracheobronchitis, and a progressive, during a progressive development, it could lead or it could reach on the bronchopneumonia, okay, manifestation. Okay, this is another picture of tracheitis based on the exudates is more of suppurative. So makikita niyo naman may mga pus, okay, form in the tracheal lumen. Okay, so the mucosa, and so notably hyperemic, and so in cattle this can be involved as a lesion of the infectious bovine rhinine tracheitis, bovine respiratory syncytial virus, and the para-influenza 3 virus infections. So that those are the common, okay, respiratory viruses in cattle. So in horses naman, equine viral rhinotracheitis. Okay, so that is how these possible microorganisms, okay, produce lesions to this structure. So we have the fibrotic tracheitis, which is diphtheritic, and one causes of a chemical, okay, exposure, nakainom siya ng chemical, yan, or Ayan, yung tsura niya, no, for may konting detachment or may konting eroding yung area na yan. So the necrotic mucosa detaching from the trachea, that is the diphtheritic membrane, okay, which a cow accidentally, ayan, naka-aspirate of ammonia chloride or yung parang chemicals, okay, which is irritant. Okay, same with this one, okay, with infectious bovine rhinotracheitis. So it produces a thickening of the tracheal mucosa. Okay? So yun yung fibrino. Okay, so tendency, di ba, in the rhinitis kanina when we describe the implications of a fibrino, okay, rhinitis, that represents parang severe. Okay, it is more severe conditions. Okay, so fibrino necrotic exudates. So for the diphtheritic membranes. So yan. Sometimes diphtheritic conditions show pseudomembrane. Okay, sasabi ng pseudomembrane because of the thickening. Okay, thickening of the affected mucosa. So, pag narinig nyo yan, lalo na kapag sa mga involved animal with mycotic infections, some viral infections, sa ano kasi to? Sa fowl, okay, the the wet pox infection, okay, sa fowl, okay, the wet fowl pox, that area affected, do sa trachea affected, nagkakaroon yan ng diphtheritic, okay, necrotic or diphtheritic tracheitis. That's the description of the wet fowl pox infection. Kasi meron tayong dry. Okay, so this is the last part. Ito na yung connections of the trachea to the last airways, okay, to the bronchi or the bronchus. So one examples that causes this kind of infections or condition is the invasions of parasites. So you see here, there is the parasites, okay, yung invasion, okay, or insisting of this parasite, pilaroides, okay, your Oslerus osleri. So there's a multiple nodules, okay, the multiple nodules, okay, which is being organized. Ayan, ito na yan. Ang dami nila, yung asterisk na yan, no? With the yung ciliated epithelium na yan. Okay, so ciliated pa rin siya kasi they are involved in the clearance. Okay. So containing this, ayan, ito yung mga encircled or the sustained parasite on the area. So these metastrongal nematodes found worldwide affecting young dogs. So the nodules are typically seen at tracheobronchial bifurcation. So if you will notice, this is the histologic picture of this nodule found in the bifurcation of the lung. So dito pwedeng mag-progress affecting some portion of the lung tissue. Ayan. So dito, pwede rin yan. Pwedeng sirain yan yung part ng lung tissue dito. Okay. So clinical signs in dogs observed in severe parasitic infections include coughing, ayan, sneezing, and exercise intolerance. So, syempre dito may mga blockade, okay, because of the tumorous, okay, or the nodules, the nodules, okay, produced in this bronchial airway. Okay, so as for the summary, so always remember, as I've told you a while ago, that rhinitis is classified into type of exudates, okay, serous, catheral, yung fibrinous, and then of course you have the mucopurulent, ayan, and granulomatous. And also these descriptions can be applicable on the other portion of the conductive system depending on the exudates. So the fibrinous rhinitis implies severe mucosal injury in which fibrinogen or the component, a protein component for the clot formations. So we've mentioned also the different conditions, diseases, mga pathogens caused, viral or bacterial, mycotic, and parasitic infections affecting your cats, dogs, horses, cattle, and sheep and goats. Ayan, so we mentioned about mga IBR, EVR. So don't forget, I mentioned na the IBR, na infectious bovine rhinotracheitis, equine bovine rhinotracheitis, para-influenza 3 viruses, adenoviruses, canine distemper, the COV2, and canine PI or canine para-influenza virus, okay, are the important pathogens of the nasal cavity. Okay, strangles affecting also the guttural pouch. Okay, dun sa horses naman. So some sequels, yun, because of the connections, meningitis, otitis, okay, retropharyngeal lymphadenitis. Yan. So those are some of the sequel. So other particular microorganism affecting pigs, so we've mentioned about the inclusion body rhinitis or the cytomegalovirus. This is the herpes virus, no? Which is also one of the differentials for your atrophic rhinitis. And Ms. Nicole kanina mentioned about the most common organisms facilitates the conditions of the progressive atrophic rhinitis is the Pasteurella multocida type A and D together with the Bordetella. Okay. In other animals kasi, the Pasteurella, the bronchi, and the Bordetella are involved in the kennel cough pagdating sa canine. Okay? So, what else now? So, other than that, so yung mga non-infectious, there is these accumulations of mucus on these cavities, and that terms mucocele. And this can be purulent exudates, and for the purulent exudates or abscess, so that is the empyema. If this will be collected in the sinuses or some part of the nasal cavity. Okay, so I mentioned about guttural pouch as a particular structure found in horses. Ayan. So na-mention na natin lang kanina, especially on the sequel. Okay, yung important sequel or consequences of the severity of the guttural pouch problem or inflammation. Okay? Okay. So do you have question? Are you still with me?
Yes po, Doc.
Opo.
Okay, so do you have question? May klase kayo after me? Hello? Hello? May pasok kayo pag... Wala na. Hanggang anong oras? Hanggang 10? Ay, hanggang lunch na. Can we continue discussing? Will it be okay? Kahit hanggang 10 lang? Hello? O, sumagot na kayo. Para makatapos pa ako ng isa. Would you like me to continue discussing or not? Yun lang naman eh. Kasi the coverage of your exam will start on homeo, okay, dun sa homeo, hemo, kasamang respi, and cardio. Ayan. And a portion of the digestive system that will be your reading assignment. Meron naman kayong LRP dun sa digestive system. Okay? So, yun. Yun yung binigay ko sa LRP yun. Yun yung gusto kong ma-include. Okay? Sa exam. Oh, by the way, di ba you have your report in the lecture? So, I'm planning to designate that topics as your final exam. Okay, but you need to parang record that and complete, okay, as how I present yung mga lectures natin. Okay, ba yung exam nyo ngayon, yung buong yan, okay, yung buo na hemopoietic to digestive. Okay, yung digestive part na yan, a portion of the digestive system will be yun yung sa part examination of the midterm. Ayan, kung sa digestive. Kasi supposedly dapat yun ang end natin ng midterm. Okay? So the exam will be after my return. Okay, kung ano yung schedule. Okay, as it is yung schedule, we will follow the schedule. So ulitin ko, for the lecture part, okay, yung groupings nyo ng discussions or yung topic given to you will be the component of your final exam. So that will be the final exam. So it will be graded to presentations. Saan ko titignan kasi you're going to present that by, i-video nyo siya. The content of the report. Okay? And if there are some inquiries kapag present nyo sa mga student or dun sa mga kasama nyo, no? Kung may mga questions sila, okay, or ako na yung magtitingin kung may mga kulang pa sa questions doon, doon ka na lang siya isang grade. But definitely, this will be graded into 3 category. Okay, the presentation, the quality of content. Okay, sa quality of content, nandun yung completeness, okay, of the discussions, and dun sa last is the updates or any innovations, okay? Or parang, ang tawag dito? Yung creativity, okay, in the presentation. Ayan. So, yun, yung tatlong na yan. Yung titignan ko. Ang pinakamabigat doon na component niya is yung quality of content. Sa quality of content, nakasama na rin siya doon yung flow or organization ng discussion. Ayan. So, sa presentation kasi, the mastery of the topic, okay, via kapag nagdi-discuss kayo in how you present that. Ayan. So, clearness of the voice. Ayan. And you present that, okay, na naka-video. So, yun naman yung kanyang points, okay, na grading dun sa finals. Okay, and for the exam, pagdating ko, ayan, so dalawa ang expect nyo. The part of the lecture which starts from hemo to digestive, okay, isang buo yan. And of course, yung laboratory, which is a presentation so per group. Ayan. So, yun yung final exam sa laboratory. Okay, so doon naman sa niya, sa part ng, ano pa ba yun? Doon sa midterm part, kasi meron tayong histological, okay, yun yung lesions, okay, yung mga lesions, familiarization. So, common lang yan. Parang ulitin mo lang kung anong pictures. Like, for example, if I present there, mga hyperemia, ganyan, for you to be familiarized. And as you observe dun sa pictures natin and presentations, nakita nyo kung ano ang mga fibronecrotic inflammations, etc. Okay, so yung mga yun, yung mga naka-incorporate na pictures in your LRP, yan, this can be basis, okay, doon sa paggawa ng slide, okay? Or yung presentations. Ayan. Para doon sa familiarizations of gross and histological lesion. Okay? My question. Clarification? Yo. Balik na ako ng 9 eh. Alis kami 5, balik kami 9. So, nandito na ako ng Monday 13. Ay, sorry, 13, 12. 12. I'll be here at 12. Nandito na ako ng 12. I-schedule na natin doon. Yung yung sa yung exam ng yung reporting yan, yan yung naka-record, pero yung presentation nyo ng tawag dito, case, face to face yan. Tsaka yung exam nyo face to face. Yan. So yung yung sa recording nyo dun sa presentation yan. So I'm hoping to see ang inclusions doon sa report nyo. Meron kang introduction part in which you include there yung portal of entry sa mga possible pathogens or foreign invaders, and then yung responses of the system to particular exposure, and of course yung yung mga diseases, okay, affecting the structure, okay, of a specific topic, okay, kung ano na yung mga nasa system nyo. So I want to see also that you mentioned yung mga common pathogens, okay, involved in that, and some metabolic yan. So nandun. And then may mga specified naman na mga animals affected. Okay, please do use a reference kay pathologic base of disease, and then you can add na others. Okay, so basta don't forget to put your references. So kapag finalo nyo si pathologic naman, wala na akong problema doon, but may additional pa kayo, just put there the reference kasi I will going to validate that. Okay, kasi meron akong may nagpasa akin, chinek ko, hindi mabuksan yung link at hindi yun ang sinasabi niya doon sa reference. Okay, anyway, sana hindi mangyari dito. Okay, so sabi ko nga, yung mga link na nilalagay nyo sa references, ayan, ay ina-open. So unless pwede kong i-validate yan. Lalo na kapag naglagay kayo ng pictures, ayan, kung meron kayong pinagkuhanan at available yung pinagkuhanan nyo na yan, you can just put the picture. Baka mamaya, sabagay hindi naman natin ibibenta o yung presentation because it's for class use only, but refrain from just getting na walang citation, okay, dun sa mga pictures. Yan. Okay lang if this is your own pictures or my yung mga output ko kasi I've used some of my outputs, especially in histology, histological output. So out from my MS dati, yun, pwede ko kasi sa akin yan. But definitely if you get others, okay, dun sa labas, please do cite, okay, the author para dun sa para dun sa prevention ng plagiarism. Okay? So yun yung napaka-important. That's why I'm asking for references, complete references. Meron pa clarifications. I want to sige. Sige, Jeriel. Okay. Mm. Okay. Yun. Yung yes, yun. Yun yung gagawin niya. Okay, so what about the other? I want to discuss pneumonia. Kaya nga tinatanong ko kayo, will it be possible to will it be possible to discuss until 10 for pneumonia? Okay lang ba sa inyo? So, papakita ko sa kasi you have that naman in your LRP. Ganon. O sige, you read na lang your LRP. So, nandun naman na lahat. Okay, wala namang problema. Nandun yung pictures, nandun yung descriptions, clear descriptions, nandun din yung mga examples ng animal, pathogens, involved in specific conditions in the lungs. And of course, dun sa portion ng transitional, ayan, kasamang transitional. Ang gusto ko lang i-point nyo kung ano yung structure ng transitional and diseases affecting the transitional and the gas exchange. Okay, same with, pagdating kasi dun sa digestive, naka-itemize na dun sa inyo, no? Marami siya, pero naka-itemize siya on these structures. Okay, kung ano yung mga structures affected. Ang hindi lang kasama sa digestive nyo is a part of the biliary. Okay, the liver, the hepatic and the biliary. Okay, system or the accessory digestive system. But the alimentary tract and its accessory pataas, the upper and lower digestive tract is now in your LRP. Okay, this is clear, no? Complete naman yung nakalagay doon. So, any more?
Doc, kasali po yung digestive sa exam po namin.
Yes. Okay, that will be a reading assignment. So,
Doc, lahat po ng digestive system?
Yun, yung binigay kong LRP ng digestive. Kaya yun, nasa ano lang yun. Yun, kasama yun. Okay?
Hindi po, Doc. Thank you po.
But definitely, may hematopoietic, respiratory, and cardiovascular. Mas marami yun pagkukuhanan. And a portion or 40% of that will come from your digestive system. So 60% pupunta dun sa tatlo, or let's say, kahit 20% lang sa digestive, the rest, okay, pupunta doon hanggang respiratory. Basta konti lang yung portion ng digestive. This is a reading assignment. But please take note of the important details doon, especially the diarrhea and portion affecting the upper. Okay? So yun yung mga target doon kasi the diarrhea is the most manifestation or manifested clinical signs, okay, kapag may disturbances of the alimentary tract. Okay, so bibigyan ko na kayo ng points doon. What else? Ano ba yung common? Okay, what are the common conditions that you observe, okay, affecting the GIT? So definitely may bloating, okay, for the pag sa ruminant naman kasi they have the specialized compartmentalized sabi nilang for stomach. So ano yung mga conditions na yan? So definitely one is bloat. Okay, so other than that, in the simple stomach naman, so ano yung mga posibleng conditions? Hindi part of the oral cavity, so ano ba yung meron tayong affected dyan? It could be the teeth, okay, so dental problem. Okay, some tumors also just like in the respiratory system, so padadaanan makikita nyo yung mga common. But definitely, diarrhea, hindi yan maalis. Okay, yung descriptions, kasi yan yung manifested. At alam nating isa sa mga possible picture of a differential diagnosis to delineate yung mga possible pathogens or possible non-pathogenic conditions causing diarrhea. Okay? So, ano pa? Wala na? So if none, that ends for our systemic pathology. So you review well. So if ever there are changes in, oh yes, yes, Juriel. Yes, Mr. Kides. Laboratory. Yes. That is a tentative schedule natin. Okay, yun na yung pag-usapan natin tentative schedule para minsanan lang. Kung matatapos natin yun, para wala nang meeting afterwards. Kasi parang ganun din yung gagawin ko sa iba. Kasi parang i-maximize ko yung week na yung week na yon, i-maximize ko kasi at 15 to 16 ay may activity. So tignan natin, no. So parang 3 days lang yung maximize yung i-maximize kong day. Marami akong hawak na subject. So titignan natin doon. So I would like to ask if it is still possible to you na pwede tayong mag-Saturday. Ayan, isang Saturday if hindi natin ma-cover yung buong report. Or if we will cover all the report, isang buo na mag-overtime. Yan. Kung hindi matapos. Kasi a matter of 1.5 hour lang naman yung exam. Okay, for the lecture part. Or yung sa may written part and the rest. Okay, pwede naman. So yun yung ano ko. Ang problema kasi dito that will use a lot of time is the presentation of case. So yun yung ano natin. Yun yung mabigat. Okay? Kasi ilang kayo, ang dami yung grupo, right? 9 or 11, 13 ata, 13 groups yata kayo. Or 12 groups. So, basta nandun. Ilan?
8 lang po, Doc, yung sa necropsy po.
8 lang. Ilan ba kayo doon? Tatlo?
By 5 po ata.
Ay,
Doc.
masyado yata. Kaya pala 5. 8, kaya. Kaya yun. Kaya. Tignan natin kung paano kasi doon sa delivery and sa deliberations. Yan. Basta maximum of 25 or 32, 25 to 30 minutes, matagal na yon. So ang presentation, at least 10 minutes, presentation of case, and then the rest, deliberation. So pwede nating i-lessen hanggang 20 to 25 lang yung course ng isang reporter. Kaya nga sabi ko, I'm asking for the paper already, okay, para meron na akong babasahin agad. And alam po na kung ano yung question ko and i-validate, okay, sa presentation.
Dok, aalis po kayo ngayon sa CVM po. Magpapasa po sana
Nandito
kami
ako.
ng paper, Dok.
Nandito ako hanggang mamayang hapon. Kung alis man ako, nandito pa rin ako. Babalik naman, if ever.
Sige,
Kasi
Dok,
may
thank
mga
you.
defense hanggang gabi. Hanggang mamayang gabi. Kaya yesterday, we were here until 6:30. Kaya pasa na kayo, nandito ako. Kung hindi nyo man, diretso nyo kay Ma'am Katet. Yan. Kung hindi ko makita ngayon, definitely I'll be here ng Saturday. Yan. So minsan dinadaanan ko siya. O ayusin ko siya.
Thank you, Doc.
Okay, sino pa? Thank you, Miss Tosca. Wala na. Okay, so if none, thank you very much for today and please do review well. Okay, good luck everyone and see you when I see you. Ayan, so bye. So yun, if you have questions na you can just PM me directly. Okay, kasi kung dun sa kung sa, pwede naman dun sa group, but if you want to diretso, okay, pwede kayong mag-PM sa akin direkta. Okay, thank you.
Thank you po, Doc.
Thank you
Don't forget your attendance, guys. Don't forget your attendance.
Thank you po, Doc.
Oh, by the way, dun sa yung ipanalangin muna natin. Kaya sabi ko nga, kung may magbabago, tuloy ang exam next week. Yun lang, ha? Ulitin ko, kung may magbabago, tuloy ang exam next week. Okay? Ang tawag dito, huwag niyong kalilimutan dun sa mga presentations niyo yung name ng group at saka yung full, yung complete members. Yung complete members doon. Yes, Shami.
Doc, can you please
You're recognized.
translate that, Doc, regarding the exam?
What? Come again?
Can you please translate
Shami?
the talk regarding the exam? Instructions po.
Instructions. Okay. Your exam will be, if my trip will push through next week, and that will be December 5 to December 9. So I'll be returning by December 9. And since next week is the final exam, so definitely we cannot do the final exam because I am not here. But instead, we will push the exam the next week, and that will be on December 13. So that type of exam, okay, the examination will be lecture and the laboratory. For the lecture, so you are part of the you have the report topics, right? In the lecture, that topic of report will be your final exam. Okay, so what I need there is your recorded video of the report, because those recorded video, the content of the reports will be the focus of my grading and evaluation. Now, for the written part, okay, of the lecture, that includes an examination from hemopoietic system up to digestive system. So that includes hemopoietic, cardiovascular, respiratory, and digestive system. Okay, so those are the coverage, and you have that all in the LRP. Okay, now for the slide are presentation, familiarizations of gross and histo, okay, lesions. Take note of the pictures included in your LRP and the presentations that I am presenting. So those are good references, okay, for you to be familiar, okay, to be familiarized with those lesions. Maybe I could get some of the pictures there or similar pictures from other sources. But definitely the descriptions describing the typical lesions, like for example, pneumonia, or example, tracheobronchitis, okay, can will not alter, okay, or will not change the original descriptions. Okay, so another, for the laboratory, so the laboratory exam is the presentation of the actual case, okay, the cases. Okay, and I had given you the options if you want to use the same final case in your general pathology, or you open another animal and presented that in the final examination for the laboratory part. So the schedule of that will be the schedule of 13 to 15. So we will talk about that. Okay, so I'm planning to give all the exam in one day. Okay, so if not, so I'm asking your parang I am asking if you want to do, okay, it in a weekend or in Saturday, one Saturday kahit half day lang for particular exam if we cannot finish that in one day. Okay, so that's the instructions of our examination. Did you get that, Miss Shami?
Yes, doc. Thank you for doc.
Okay. Now, if you want to clarify again, you can just PM me and I can just tell you again.
Oh, okay, doc.
Okay. What about the others? Before I end.